Good morning, everybody, and welcome to CFO Coffee Talk, brought to you by the Florida CFO Group. We have a great show this morning because we have two heroes as our guests, uh, Dale West and Stephanie Koch, who are supporting Henry Marine as a fractional, as a CFO and a HR leader, are with us, and they were dubbed healthcare heroes at the World Finance Forum in Miami earlier this year. Dale, Stephanie, thanks for being with us this morning.
Thanks for having us.
Fun to be here.
So I'll set the stage and tee it up by saying that 4 years ago, I had done about 30 budgets in my career as a CFO and had the same experience most of those 30 years, where the highest growing expense line was health insurance. And it was the least fun to work because I thought our only option was how to share the pain between the company and the employees. And then Dale suggested that I go to a ACRIM conference in Orlando, Florida, where I learned that there was a lot of innovation and hopefulness in the field of healthcare cost management that uh, really gave me a feeling that all is not lost here, that there are people working on better solutions. And Dale and Stephanie were able to deploy those better solutions, leading to $5 million of savings for Henry Marine while improving employee support and care. So eager to hear the story. Dale, what prompted you to dive into these waters?
Well, in 2017, we were talking to our insurance company on our renewals, and apparently we had four claimants. Four of our employees were high dollar claimants, over $300,000, and we were facing a 75% rate increase, which was
Wow.
almost approaching $2 million, which would really hamper our profitability. So we used our broker. We went to the other large insurance companies and got the same message. So in a panic, I had been talking to a couple of other brokers that were familiar with going self-funded, and we called them. And bottom line, we in 2018 we went self-funded. We used the current insurance carrier as a platform because we wanted their network, and we used their pharmacy benefit manager. And that year, we still had a 35% increase. The following year, we got more aggressive. We dropped the insurance carrier's platform. We went directly to the benefit or the pharmacy benefit manager, where we now get the rebates instead of the insurance carrier. We went with reference-based pricing, which is, they would basically negotiate our prices with the facilities, and they would be based on typically Medicare. And in Florida, Floridians pay 550% more over Medicare cost in Florida, one of the highest states in the nation. So, so at the end of 2019, we had a third party administrator. We negotiated our contracts and claims with with our benefit reference based pricing manager, and we carved off the pharmacy. Now we got the rebates, and that set the stage.
Very good. So, kind of a bold move for a company to go away from the traditional form of healthcare. How were you able to sell that to your CEO and board?
Um, Two things. One, I probably omitted. In doing that, we had a stop loss insurance, so we had two levels of stop loss where our claimants couldn't go over a certain, if they went over a certain dollar amount, we were covered, or if our aggregate went over a dollar amount. But with our CEO at the time, it was, he was in a panic too. He was responsible, so he was cooperative. And I'm very fortunate to have an HR department that, is thinking out of the box and working. In fact, when Stephanie came and interviewed with us, I sat down with her and says, one thing you're going to have to get a handle on, is, and I kind of went through our structure, and apparently turns out she had been doing the same thing for 3 years and dealing with the same third party administrator and the same people I've been dealing with. So we didn't miss a beat.
So, Stephanie, tell us about your background in this space and what you did before helping Henry Marine and what you did at Henry Marine.
So I've been an HR practitioner over 25 years, which I hate to admit, but that's the truth. But I lived in the fully funded healthcare space for many of those years. But the last 10 years, I was introduced to self-funding. And the last 7 years I was at a different company, and we had that same experience. We were working with one of the big BUCAs, Blue, United, Cigna, Aetna. And we had a fairly young demographic, our workforce, but yet we were still faced with an 18% increase. So, similar to what Hendry did, we took that leap of faith and said, we can't do this anymore. So we went outside the box and started working with reference-based pricing. And that's where I started my experience. So I was able to bring that over to Hendry back in 2019. So it was a very smooth transition.
Now, but as an HR practitioner, you probably know very well that employees sometimes don't embrace change. They get nervous when you're talking something as near and dear as their healthcare benefits. How are we able to navigate that terrain?
Well, I will say this, no matter what plan you change, you can tell them their benefits are free. They're probably still going to have some issue or concern. So there are things that a company really needs to do is focus on the communication. We were very careful to make sure that during our open enrollment meetings, for example, any questions that the employees asked, became a frequently asked questions document, because if they had that question, most likely other people had the same question. You also have to make sure that they understand why and how the healthcare system is broken. In our traditional healthcare space, our employees are paying money at facilities that's, say, 55% off of a charge, but you don't know what that charge originally started at. So it's really a mystery because there's no transparency. Whereas explaining on this side of the fence, there's a lot more transparency. And if you're not working with the data to be able to make strategic healthcare decisions, then you're basically writing a blank check to your healthcare company every month.
So these options of self-funded plans, TPAs, pharmacy carve-outs, how big of an employee base do you need to have to really have that work for you?
So typically employers that have at least 50 or more covered employees on their healthcare plan really should consider this type of plan.
So
Phil, one of the biggest things that we had to communicate to our employees is, if you get a balanced bill, don't panic. We'll just turn it over to our third-party administrator and they'll negotiate it for you. So that was one of the biggest communications. It's don't worry about it. We'll take care of it.
Okay.
Yeah, the employee still has the responsibility of paying their deductible and their co-insurance related to whatever plan design you have. But to Dale's point, you have more advocacy on this type of plan than you might have with a traditional healthcare carrier, which was a really nice way to explain to the employees what kind of support they were going to have that they don't currently have.
You make it sound so smooth, but I'm sure there were challenges along the way. Dale, what was a big challenge that you had to overcome in the transition?
Probably working with some of the below the CEO, some of the vice presidents, some of the, the presidents of the companies that we own. They probably had some of the biggest questions. And part of it, I have to say, is they had a relationship with the previous broker. So I'm dropping this broker, going to a new, broker. And that was probably, a couple of my, if I had some horn locking or, that was probably with that level of management.
Stephanie, from a people standpoint, what kind of issues, challenges, resistance did you meet?
So typically it's, an employee that wants to see their primary care doctor that they've been seeing, their whole life. And, because some physicians may not be familiar with the TPA type of structure, it's a matter of making sure the employees know how to communicate to their physicians, that, we're on the self-funded plan. They need to call the doctors off, they need to call the company to verify the benefits. It's really just explaining It's the same, but they just need to call someone different. So it's that challenge of getting them to understand that.
How did you, what did you find was the most effective way of educating the workforce as to how to extract the best benefits from the new system?
I will interject here. I will say that we did a good job communicating up front, but as issues arrived with the employees, the HR department just bent over backwards to, in some cases, communicate with the third-party administrator, in advance. And then I think one good example is one poor employee had overpaid. He got a balance bill. It was like something like $5,000. He paid that. Our TPA went to bat for him and got his $5,000 back, and that communication went through, the shipyard pretty good.
Okay.
Yeah, constant communication is key. It's not one of those set it and forget it type of plans. It's just like any other plan, but making sure the employees understand the depth of support and the benefits that they get. Because our benefit designs actually improved, the quality of care improved. Having a plan like this doesn't mean that your plan integrity or quality gets compromised. It improves. So that's one message I want to make sure I send.
How does it improve? Explain that, please.
So essentially, our employees can go to any hospital. They can go to any doctor as long as the physician is willing to work with the healthcare plan. And like Dale said, there's more advocacy on the back end where if the employee gets a balance bill, for example, there's someone there to help support working through that to make sure they're not overpaying for services. Because despite our, company, our reference-based pricing company advocating for the employee on the front end and making sure they're not overpaying for services, they're doing the same thing on the back end because the providers are still going to keep billing despite the employee may not, even though they may not owe the money,
And we reminded our employees, and they know they have not had a participation increase in 4 years. So with our savings, and going through this, we have not increased their participation other than maybe a tobacco,
tobacco
surcharge. But outside of that, if there was no changes in their insurance contribution.
Yeah, we've actually improved the plan as well, Phil, because we actually created our own healthcare ecosystem. And like I said, in the reporting and data transparency, we were seeing there were some things that were real issues like preventative wellness visits not being done. So we actually retained the services of an on-site clinic. So we created our own primary care doctor's office on site, which then, essentially provided additional care for our employees and their covered dependents. So now we have over 50 employees of our 300 using them as their primary care doctor. So there's no more excuses.
Very good. So I always try to sneak in a fun question as we near the end of the show. And with you two being such a dynamic duo, being dubbed as healthcare heroes, I have to ask, and I'll start with you, Stephanie, are you the Batman or the Robin?
I want to be Batman.
How about you, Dale? What are you dressing up?
Yes, you're Robin.
I'm Aquaman. Yeah.
All right.
I really want to be Wonder Woman. But
Okay, Wonder Woman and Superman. I should have had you dress up with capes and costumes and all. All right. Well, it's great to have you two heroes on our show, and thank you for sharing these insights. I know it was a real eye-opener for me when I learned about it 4 years ago, and I hope some of our viewers take the initiative to realize that fighting the healthcare battle doesn't have to be so hopeless. You two are a shining example of how to turn that into actually a cost saver for the business. Now, we close each show with our guest leaving us with a one-sentence key takeaway. Dale, what's yours?
I'm just continually amazed at how many CEOs and CFOs are unaware of these options or unwilling to explore these options to save their healthcare benefits.
And Stephanie, your one-sentence takeaway.
I would say be bold. Think outside the box. As a fiduciary of your companies, you owe it to not only your company, but more importantly, your biggest asset, your employees, to explore these options and, get them quality health care that they're working hard for. So.
Great. Well, Dale, Stephanie, thank you for being on our show. You guys are awesome. And we'll
Thank
see
you
you
for
around.
having us.
Take care.